Hello, everybody. This is Dr. Langdon again, board certified pediatrician, mom to 6 and grandmother to 2, with a little chat today about the current amoxicillin shortage. And honestly, that shortage has pushed the shortage of multiple other liquid or suspension antibiotics that we use in children. You know, in children, because they can't swallow pills, we have to use liquid, but that works out well because then we can fine tune the dosage based on their body weight. So we dose everything in milligrams per kilogram. Well, what I want to talk about today is that some parents have this mistaken notion that if their child can just get prescribed an antibiotic of some sort, it will make everything better. So I want to share a few things with you guys. You never want your child to have antibiotics unless they absolutely have to. So just because the cold's been lingering a bit, a normal cold takes 2 weeks. Just because the cough's been lasting a bit with a normal cold, the cough can last 3 to 4 weeks. That's no reason to go to your doctor and insist and put pressure and really push us to prescribe an antibiotic. An antibiotic is not going to help your child in that prolonged cold and cough situation. It's only going to cause diarrhea, potentially yeast infections. And the big picture is, and this has really become very scary recently, overuse of antibiotics can drive the development of resistant bacteria. So then we're going to create, and already have been doing this, super bugs that we cannot kill with the antibiotics that we have. So it does not do your child any favors to be on antibiotics. Let's talk about ear infections. In the United States, we do use antibiotics. We consider an otitis media or a middle ear infection a secondary bacterial infection following a typical viral upper respiratory infection. Well, ear infections are not yes or no. They are bulging bright red with pus or completely perfectly clear. There's a whole spectrum. So it is even possible that if we look in your child's ear and the drum is not inflamed, it's not bright red, the fluid just looks like clear fluid. And this can happen from allergies, from inflammation, from just a normal cold, that we may decide in the best interest of your child not to treat with oral antibiotics. Oh, let's talk about this. One of the most common reasons why parents or grandparents may pressure us, the pediatrician, to prescribe antibiotics is because the child's mucus is green or yellow or discolored or thick, not just clear and drippy like it may be with allergies. Well, that doesn't mean that the child has a bacterial infection. Yes, they have an infection. It's a cold. A cold is a viral infection. Viruses live inside of our cells. I can't kill them with antibiotics. It does not mean that I don't believe that your child is sick. Please, moms and grandmas, don't give dads and grandpas a hard time if they bring that precious child home without the much desired antibiotic prescription and berate them for not convincing us how sick the child was. It doesn't mean that we didn't believe they were sick. Many viral infections, look at COVID, look at flu. Flu's horrible. COVID can be horrible. Make them very sick, but that doesn't mean I have an antibiotic that can make them better. In fact, it could make them worse. Many viral infections cause diarrhea, so to add antibiotics in would just make the diarrhea worse and do nothing to kill that virus that's inside the cells. An antibiotic can only kill a bacterial infection. The bacteria are alive outside the cells. So let's think about strep throat. Yes, group A beta hemolytic strep, a throat infection, a pharyngitis, has to be treated with oral antibiotics because if it's not, it can then go on to create complications from untreated strep. So we never want that to happen. We do in the U.S. treat those really bad episodes of ear infection, and we do treat bacterial sinus infections if they meet certain criteria, which we can decide at that visit. Primarily worsening at the 2-week mark, maybe new onset of fever, sometimes associated symptoms, things getting worse instead of better at the 2-week mark. So if we do recommend your child uses an antibiotic, certainly please listen and we would have a reason for doing that. But most of the time, I feel like we're trying to convince caregivers that the child doesn't need one because we're trying to protect your child. So I want to tell you that green mucus is good. Green mucus means your child's immune system, their own body, the way it was designed to work, is fighting off this current viral upper respiratory infection. It is sending white blood cells into that mucus to fight the infection. That's a good thing. That does not mean we need antibiotics with all their problems. It means your kid's body's doing the right thing. It's doing the job it needs to do. And so a lot of times if the mucus has been sitting in the nose for a while in the sinuses, it may be more discolored. So freshly produced mucus may be less discolored, and old mucus that's been sitting there, because then it gave those white blood cells a chance, time to get in there, may be more discolored when it finally comes out. So I hope this has been helpful, you guys. It never means that we don't care about your child when we don't prescribe antibiotics. It doesn't mean that we don't believe that they are genuinely sick. It means that we understand it's important for us to follow guidelines. We understand the really scary consequences of overusing antibiotics. Hope that helped. Thanks.